people with elevated blood pressure that falls within the normal recommended range are at risk of accelerated brain aging, according to new research from the Australian National University ANU. The research also found optimal blood pressure helps our brains stay at least 6 months younger than our actual age. The researchers are now calling for national health guidelines to be updated to reflect their important findings. The ANU study, published in the journal Frontiers in Aging Neuroscience, found participants with high blood pressure had older and therefore less healthy brains, increasing their risk of heart disease, stroke, and dementia. Participants with an elevated blood pressure but within the normal range also had older looking brains and were at risk of health problems. Normal blood pressure is defined by pressure below 120/80, whereas an optimal and healthier blood pressure is closer to 110/70. The new research comes after a large international study found the number of people over 30 with high blood pressure has doubled globally. The researchers said if we maintain optimal blood pressure, our brains will remain younger and healthier as we age. It is important we introduce lifestyle and diet changes early on in life to prevent our blood pressure from rising too much rather than waiting for it to become a problem. The ANU team, in collaboration with colleagues in Australia, New Zealand, and Germany, examined more than 2,000 brain scans of 686 healthy individuals aged 44 to 76. The blood pressure of the participants was measured up to 4 times across a 12-year period. The brain scan and blood pressure data was used to determine a person's brain age, which is a measure of brain health. Lead author Professor Che Buin said the findings highlight a particular concern for young people aged in their 20s and 30s because it takes time for the effects of increased blood pressure to impact the brain.